With the Delta variant surging, the White House is calling on all Americans who have had the COVID-19 vaccine to get a booster. And in Mississippi, boosters have already been recommended for people who are immune compromised, including cancer sufferers. Joining us to talk about those booster shots is Dr. Shah, an advisor to survivors of cancer and cancer patients getting connected with specialists. Dr. Shah, how does a third shot benefit those who are immune compromised?
Thank you for having me. A third shot is important because we now know that after time, the ability of this vaccine to protect goes down a little bit over time. And so a booster shot will help to, exactly as it states, boost the immune system to be able to fight COVID.
And how does a third shot scheduling typically work?
Yeah, so right now, third shots are available without an appointment for patients who are considered immune compromised, such as cancer patients actively going therapy, or, for example, solid organ transplant patients. And they can actually go without an appointment to Walgreens or other types of places that are offering vaccines and get the third shot. No prescription is required.
Now, can you mix and match the Pfizer and the Moderna vaccine?
Right now, we should not be mixing and matching. If you got the Pfizer, you should get a booster or a third shot of the Pfizer. And similarly from Moderna, if you got that, that should be the booster shot that you get.
Is that also true for patients with the Johnson & Johnson?
At this time, we don't have enough data to recommend a booster shot for the Johnson & Johnson vaccine. We expect that data to be forthcoming, but right now, they're only able to authorize the Moderna and Pfizer boosters because those have more data of safety studied in the booster setting.
And what are some of the side effects that people could see from this treatment?
Side effects to the booster shot are going to be very similar to the ones that already happen for a patient, particularly with their second vaccine. And there may be some soreness at the vaccine site, maybe a little bit of flu-like symptoms, but in general, fairly well tolerated and considered safe.
For the benefits at large of the population, what does that also look like?
Very interestingly, this week, the FDA also suggested that all people who have had vaccinations will be getting or will be eligible for a booster shot, and it's recommending this booster shot similarly to how we look at the flu shot, where people get something every year, and it's a maintenance sort of thing. And therefore, in September, they're going to open up in the masses this booster shot to everyone. And at that time, people who have been several months out will be the first in line, for example, healthcare workers, because they will have had the longest time from their previous vaccine.
So looking ahead, do you think that booster shots will also be something as common like getting the flu shot? Or is this something we're going to have to get every season?
I really do think this is something that's going to be part of our new vaccine timeline, that we get something every year. For example, the flu shot we do get every year, and now I think this will be indicated as well.
Well, thank you so much, Dr. Shah with SurvivorNet. We really appreciate you joining us today. We'll be right back.
Thank you.